Bismillahirrahmanirrahim. Assalamu alaikum. This is Khadija Mohammadi with roll number BP1650104 from group number 16. I'm here to present nocturnal leg muscle cramp, that is a peripheral vascular disease. First, what is peripheral vascular disease? It is basically blood circulation disease, and it causes the blood vessel outside of your heart and brain to become narrow, or we can say blocked. This affects both arteries and veins. Peripheral vascular disease or PVD typically causes pain and fatigue condition, which is often in legs and especially during the exercise. It normally improves with rest. Besides, it can also affect all those vessels which carries blood and which supplies the oxygen to arms, stomach and intestine, shortly we can say GIT, and lastly the kidneys. As we know, in PVD, the blood vessel become narrow, which will lead to the decrease in blood flow, and this is mainly due to arteriosclerosis, that is a plaque buildup or resides in vessel, and that will decrease or limit the blood that carrying the oxygen to organs and especially the limbs. Now, if we discuss the causes, then emotional stress, cold temperatures, operating vibrating machinery or tool, which are usually used during diagnosis of any condition, and mainly the drugs. These all causes the functional PVD. Besides, smoking, high blood pressure, diabetes and high cholesterol are organic causes of PVD. Now, if we talk about the symptoms of PVD, then on the basis of area of pain, 5 basic categories come under it. Number 1 are legs. In this, the symptoms are usually cramps when one is laying on bed. Number 2 category is legs and arms. In this, the symptoms usually observed is turning the legs and arms to reddish blue or to pale. Number 3rd category include legs and feet with symptoms of thin and pale skin, weak pulse, wounds or ulcers with critical condition that it wouldn't heal up. Number 4 category is of toes, that the toes become blue in color with severe burning. The last category is of muscle that feel numbing condition. Our basic concern here is with category number 1. Now our topic comes, that is nocturnal leg muscle cramp. Now, by observing first diagram, it is a resting condition, means our body calf muscle is relaxed. Now if we pull up our heel, standing on the toes, the muscle contracts. That means it goes opposite to the resting condition of muscle, and that is normal. But when we pull down our heels standing straight on the floor, this muscle doesn't relax, but in normal condition it must goes opposite to contraction, that is relaxation. This abnormal condition causes cramp in calf muscle, and this condition is known as nocturnal leg muscle cramp. Basically, nocturnal leg muscle cramp is idiopathic condition, that means its cause is unknown. Basically, it is an involuntary contraction which occur at rest condition and causes a visible and palpable knot in the affected area, means in the calf muscle. This type of muscle cramp condition usually observed in middle-aged to elderly persons with stress, discomfort and painful conditions. As it is a idiopathic condition, so many hypotheses are proposed. Out of that, 2 primary hypotheses that explains pathological, pathophysiological and neurological impairments are: number 1 is CNS impairment of gamma aminobutyric acid, that is GABA, and secondly is peripheral response to muscle lengthening is impaired. To find out the exact cause, many surveys are conducted. First, if we talk about survey of veterans, that is 95% man with average age of 60 years. Out of that, 56% complained about leg cramps With 12% having cramping nearly every night, the remaining 36% veterans also take drugs to treat their symptoms. Now, General Population Survey says that of 80 plus age are affected with nocturnal leg muscle cramp. So concluded that majorly it affects males with elderly age population. As it is a PVD condition, so PVD associated causes includes arteriosclerosis, somewhat coronary artery disease, but majorly peripheral neurologic deficits. Now we have case of a woman. Her age is 62 years. She complains of cramp in her left calf muscle that begins at 10 p.m. last night. The cramping occurred several times throughout the night and has slowly resolved since she arose this morning. According to her, these nighttime cramping episodes occur frequently and are very painful and cause her calf muscle to become knotted. On asking about any trauma, fever, or chills, she denies and she has no other medical problem and not taking any medication. According to her, the pain is not associated with the walking. The physical examination is unremarkable, means we can't able to mark any related disease which can cause this, and her vital or main signs are stable. When extended chemistry panel that include various tests and thyroid function tests to mark any calcium related deficiency are done and examined, they all are in normal limits or ranges. On taking her family history, she remembers her aunt taking a pill for her leg cramp. So now we will go for any medication that may help to relieve her symptoms. Dealing with case study according to SOAP note. The subjective is a female with 62 years age with the nighttime cramping episode which occur frequently and are very painful and cause her calf muscle to become knotted. Also, she remembered her aunt taking pill for her leg cramps. The objective says that when physical examination is done, that was unremarkable and her all vital signs are stable. Further, when extended chemistry panel and thyroid function tests are done, they all are in normal ranges. By observing the pain and muscle knotting, it is assisted that the patient is suffering from nocturnal leg muscle cramp. Here the patient is advised to exercise and it is a non-pharmacological recommendation. Further, the patient should stretch the afflicted muscle or perform dorsiflexion of the feet throughout the day and especially before bedtime. During nighttime while sleeping on stomach, the patient should avoid plantar flexion by hanging the feet over the edge of the bed. In the plan, the pharmacological recommendation include the use of quinine that comes with the US brand Quiliquine with the dose of 200 to 325 mg per day for 4 weeks, but depending upon patient age and pain severity, the dose and extent of dose is adjusted. Means if pain is severe, then obviously the dose, with high doses, but within range. Secondly, if any electrolytic deficiency or imbalance is observed and need any replacement, then administration of vitamin E with dose of 800 international unit per day or more is done. 800 international unit per day is minimum, but if imbalance is converting into deficiency, then obviously the dose is increased according to need. When some special condition comes, then use of verapamil with dose of 120 mg at bedtime is needed till response is observed. Some notes regarding this case. While taking quinine therapy, after 2 weeks, the check is must. If no effect, no response is produced, then discontinue due to side effects, and usually any side effect is observed from any medication, discontinue it immediately. In non-pharmacological recommendation, we had mentioned that to perform dorsiflexion. So how it is performed? It is performed by gripsing the toes, then pulling them upward in the opposite direction of the cramp. Now here, remember, while discussing the diagram of nocturnal leg muscle cramp, we mentioned that in the normal condition, the calf muscle should relax after contraction. So here we perform opposite direction pulling to take out the muscle to normal condition. So dorsiflexion can be accomplished with the help of hands, by walking, or by leaning towards the wall while standing 2 feet away from it and maintaining the feet flat on the floor. Prophylactic stretching and alternation of sleep position should be tried and evaluated before initiating quinine therapy. The success of quinine therapy depends on the decrease in severity and frequency of cramping attacks. As we said that quinine therapy is associated with side effects. These include synchronism. Synchronism is a syndrome, and it includes nausea, vomiting, blurred vision, tinnitus, and deafness. On overdoses, the adverse effect comes, and that include CNS manifestation, which include headache, confusion, and delirium. So care should be taken while using quinine. To minimize GI irritation, quinine dose must be taken with meal. For special cases, when the patient is suffering from quinine resistant cramps, then verapamil is given, and it is effective treatment for that, and usually the response of verapamil is observed 6 days after the treatment starts. If verapamil is not available, then diltiazem can be used as an alternative. So conclusively, to minimize the occurrence and progression of adverse effect of quinine, careful patient selection, patient education or counseling, and vigilant monitoring for side effects should be done. Thank you.